Good afternoon, everybody. Today is November 12th, 2021. My name is Scott McGann with the Falmouth Health Department doing our weekly COVID-19 update. Some of the data is going to be a little old. Some of the data I get, like incidence rate and number of vaccines, I get on the Thursday report from the state, and the state did not do a Thursday report. They'll probably do it today, but that'll be after 5 o'clock, and we do this at noontime, 1 o'clock, roughly on a Friday. So I don't have like this week's incidence rate just because I need them, to pull the way they pull it, just to be consistent. And vaccination, I wouldn't know, definitely wouldn't know without that report, although they're not much different. So our website is falmouthma.gov. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. So we had 25 cases this week, bringing our case count to 2,104. There were 4 probable cases. Last week, our incidence rate was 8.7. It'll be very similar this week. It won't be, that won't drive it too much. It'll be somewhere in that same ballpark. It'll still be in the low category among CDC for an incidence rate per 100,000. And our positivity went from 1.61 to 1.74. So basically very similar to the previous week. If you look at our case counts, the far right is the most recent data. You can see there's sort of a little bit of an ebb and flow that's been happening. I see that with the county numbers as well. A couple weeks where it's a bit elevated, a couple weeks where it's quite low in the teens, and then it seems to sort of bounce around a little bit. So not an appreciable difference, but a difference nonetheless. But still puts us in that sort of same ballpark of where we have been, more recently. And again, the flatter the line, the closer the circles are together, the better times we are having. So we had a little bit of an upward swing in the August, September sort of, and you can see it's a little flatter and a little bit better. So we're not in a bad shape now in the last couple of weeks. This is the county chart. Again, I don't have a new one since the 4th. I haven't had anything from the county. This is provided me by the county. But the main thing I always take out of this one is that the far right, where you see the dark orange color, would be, in the dotted line. May 29th is when we listed the mandates. And then we had almost no cases in June. When you see moving, towards into July, which would be in sort of this area here, when Delta shows up, you don't see this huge Delta spike. So, like the spike that you see in green is the holidays. Then there was a blow-up mid-Cape that worked its way into Falmouth as well that would be shown in blue. With Delta being, 2.5 or so times more transmissible, and that spike, even if we would have maintained a mandates, such as social distancing, masking, capacity limits, and so forth, and we had just kept maintaining because we didn't have a vaccine, this spike still probably would have been twice as high as that green one. The fact that it hasn't is because of vaccinations. So that's a good sign. But you do see sort of an undulating up and down sort of pattern to this, and that's kind of what we're seeing here in Falmouth as well. Again, this is also something that hasn't been updated since last week. Just don't have the numbers. It's been 0 and 0 the first week or so in November. Sometimes the county gives this to me late on Friday, but this is what I have for today. I don't foresee it being any different or much different. Case-wise from the cases, so this is November 10th data. They were at 1,700. It's been somewhere in the 1,000 to 1,500 on a given day. The positivity on this particular day is 2.15 for the 7-day average. That's a little bit higher. That was below 2 for a while. Don't necessarily think that's a sign of things to come, but can be. I mean, we are going to be going indoors. We do have the holidays right around, and that will tend to drive the cases upward, no doubt. But it shouldn't be hopefully it's not to a point, with vaccinations that it gets to a point where the hospitalizations and deaths get, really, really high or anything of that nature. So, this is where our cases are, and this is kind of where it's been for a little bit of time. If you look at the trends, you can see it's sort of flat on testing, positivity, deaths, daily deaths, cases is sort of all in pretty, relatively flat. Now, again, the holidays are coming up. I wouldn't be surprised to see an increase in some of these. But hopefully with the vaccinations that we have and good common sense that it doesn't get too high. This is COVID-19 cases in fully vaccinated individuals. So of all vaccinated individuals in Massachusetts, outbreak has occurred to 1.2%. Hospitalization is 0.04%. There's been 58,807 breakthrough cases. Hospitalization is about 3.8 roughly percent, and deaths have been 1 to 1% of those that get COVID that have been vaccinated. So that's still encouraging, still good numbers. This hasn't changed. Cumulative percentage of individuals who are fully vaccinated by county of residence. Fully vaccinated, the entire population, 74%. We haven't started to include the 5 to 11-year-olds. Well, when we include that, that'll increase those that are eligible, which could drive this up. It'll drive the number of eligible people, that percentage, down because you're just adding more eligible people and we're starting at 0%. Eligibility of fully vaxxed is 81%. So that number is the one that's going to go down 81%, only because you're going to add more people to the mix, to the eligibility, and that number will go down because all the 5 to 11-year-olds will be at 0, and then we'll work our way back up from there. Again, this is last week's data. I only get this from the state. I only know it from that report. So we're 92% of all eligible residents have received at least one dose, with 82% of all eligible residents fully vaccinated. Again, those numbers would go down when the eligibility goes up. We did see a good increase last week of 400 doses. I think we'll probably see a similar good influx of doses, and I think that's being driven by occupational requirements that came down from the feds. Vaccine eligibility, again, pharmacies, plenty of vaccine at the pharmacies. The Barnstable County Health Office does a clinic once a week. Convenient MD, I believe, they had some last time we spoke. Community Health Center, homebound should be calling the health department. We'll schedule it with the VNA. The VNA, the Visiting Nurse Association, would come to your house and we can take care of that. That's if you're fully vaccinated. So the place to find vaccines is vaxfinder.mass.gov. Testing, Convenient MD, CVS, Falmouth Hospital with a doctor's note. The Fairgrounds, Thursday 4 to 6 is free. Community Health Center also does it. They're in Mashpee. I think there's a site here in Falmouth, but I think they test mainly out of Mashpee. School-based test and stay program is still in place. So all the testing has not changed since last week. Booster doses, if you're considering a booster dose, you need to be, and if you had either Pfizer or Moderna, you need to have at least be 6 months out from your two-dose regime of two-dose series of shots. You're eligible if it's been 6 months and you're 65 and older, or 18 and over, then long-term care, 18 or older who have underlying medical conditions, and 18 or older who live and work in a high-risk setting. So that's for Moderna and for Pfizer. J&J, anybody at least 2 months from their initial dose, and you're at least 18 years or older. And it is okay to mix and match vaccines, so you can mix and match. And again, plenty of availability at your pharmacies. We're not running big health department-run clinics at this point, or county-run clinics, nor is the state, because the demand is being met, at the pharmacies and so forth. So that's where we are. If we see there's a huge demand, something happens, we go up in demand, then we can always turn on clinics and have them. What's high risk? First responders, educational staff, food and ag workers, manufacturers, corrections, postal, congregate care, public transit workers, grocery store workers. Those are the list. That's a state. I haven't seen an update on that. So if you're in high-risk work, you're also eligible to get a booster. Vaccine is here. The Falmouth Public Schools should be sending something out any second now, or any day now. If you want to have the dose administered to your child at the school. Pediatricians have them already, so you can talk to your pediatrician. It's a third dose of Pfizer. It's all approved. Actually, it's a couple weeks ago. The slide's a little old. I have to fix it. So, yeah, so you definitely have eligibility for 5 to 11-year-olds. So if you're considering it for your child, they're here. Now, contact your pediatrician or work with the Falmouth Public Schools, but we do have them. A couple of new oral treatments. I showed this you last time. Molnupiravir is one of them that's Britain has just approved, and Paxlovid is another one as well. So some oral ones down the line will be great. That'll be given to you by prescription. You take it while you're at home, and it really does limit hospitalizations, at least in the studies, and that's another tool in the tool bag. Face coverings, nothing's changed with face coverings. Again, Falmouth still has a mask advisory. The state wants you to wear masks if you're unvaccinated or vaccinated with a weakened immune system or at risk. And still in public transportation, also in schools have it. CDC is recommended, and still haven't heard anything different. Unvaccinated should wear a mask indoor places, and vaccinated should do it in areas of substantial or high transmission. And we talk about that in this next slide. We're in the low category, even though I don't have this week's incidence rate. It's going to be roughly the same, or maybe slightly up a little bit, but still going to be in that lowish to maybe slightly towards moderate. Still nowhere near substantial. 50 per 100,000 in Falmouth is over 120 cases per week for us. And our positivity is still in the low category. I have no indication that hospitalization definitely aren't an issue at this point. And with our vaccination rate. So we're not at a point where we're looking at these three areas where we're in an area where we would change our current mask advisory or any other further mitigation. Obviously, businesses, entities are free to do it themselves. But as far as us, we're advising masks in indoor places for those that have been vaccinated. In terms of flu clinic, we just had one this week at the senior center. We have one more this upcoming Monday from 3 to 6 at the Gus Canty. We do not have a lot of people signed up for it. So if you're thinking about it, there's plenty of open spots. Just call us at the health department, 495-7485. We'll schedule you. Want to bring your forms, we have them online. Just call us if you're thinking about having it, by the end of the day today. And we'll bring a few extra, I'm sure, for it on Monday. If you've, changed your mind or hear it during the weekend and you really, really want it, best to do is probably call us first thing in the morning so that we know. If you wait till Monday, but that's our clinic. And that's not going to have any high dose. We did our high dose this past Monday. It'll be regular dose, and it'll be anybody 6 months or older. Also, the Farmers Clinic, pharmacies have a lot of vaccine. It's relatively new, maybe in the last 10 years or so. You're seeing the pharmacies take over sort of a lot of the vaccinations with flu shots. So you can still get one there. I think maybe that's part of the reason why we have a little bit less at our clinic. It's a little bit later than we normally do. Usually we do it right at the end of October. But I think one of the main things is people are, becoming more comfortable having the pharmacies do it. And I'm seeing probably more activity at the pharmacies. So as a recap, our cases are fairly stable. We have that sort of like a wave. It's up and down, but not where we're spiking really high. There are new oral treatments pending, which is great. Vaccine eligibilities between 5 and 11-year-olds. Again, pediatrician can be your spot if you prefer to, and also the schools will be doing it. Third dose and boosters for all vaccines are available. That's redundant. So in that regard, it's not a big change from last week. I'll have better updated data. And on the website, when I get the data for today, I'll put it on the website with the most recent information, the stuff that's not in there from the state. The slide I show that has the vaccination by age, that's on there. I put that on every Friday afternoon. I'll probably have to put it on over the weekend or late Friday when I get it from the state, and also the new incidence rate as well. So that's the recap that I have for this week. And again, we'll do this every Friday until conditions get to the point where we don't need to. And hope that's soon. So everybody take care. See everybody next week. Thanks.